Monica Jones, prominent trans activist and founder of the Outlaw Project, and Kiefer Paterson from the Harm Reduction Coalition. In other words, a dream team. I will tell you more about them as I introduce them. To learn more about them, though, you can check out our website, criminaljusticeinitiative.org. We are recording this webinar, so I just want everyone to know that as we make presentations and move forward. Of the 2.3 million people in the U.S. prisons and jails, 1.5 million suffer from substance abuse, addiction, and another 458,000 people in prison either had histories of substance abuse, were under the influence of alcohol or other drugs at the time of committing their crimes, or committed their offenses to get money to buy drugs, or were incarcerated for an alcohol or drug violation. Combined, the two groups make up 85% of the U.S. prison population. Alcohol and other drugs are significant factors in all types of crimes, including 78% of violence crimes, 83% of property, quote-unquote, crimes, and 77% of public order, immigration, or weapons offenses, as well as probation and parole violations, according to a report, Behind Bars 2, Substance Abuse and America's Prison Population. Simply put, ending mass incarceration requires solutions to the problem of addiction and drug abuse in the U.S. Deborah Small from Break the Chains is going to tell us more about how we got here and what harm reduction really means. Deborah Peterson Small is the executive director of Break the Chains, an advocacy organization committed to addressing the disproportionate impact of punitive drug policies on poor communities of color. Founded in the belief that community activism and advocacy is an essential component of progressive policy reform, Break the Chains works to engage families and community leaders in promoting alternatives to the failed war on drugs by adopting public health approaches to substance abuse and drug-related crimes. Break the Chains is an advocate and voice of those affected most by drug policies, but too often unheard in policy debates and decisions. Deborah?
Greetings. Can you hear me?
We can.
Okay, great. So, listening to Aaliyah's statistics, you would really believe that the principal problem in our society is alcohol and drugs. But literally a week ago, I was in a country that has chosen to take a totally different approach to the problem. They decriminalized possession of all drugs over 15 years ago. And so their prisons are not filled with people who have problems with alcohol or drugs. They're not filled with people who have mental health problems. They're filled with people who actually pose a danger to society, which is very different from the situation here. And one of the principal reasons that they were able to do that was because they embraced the concept of harm reduction, which means meeting people where they are, accepting the fact that drug use is part of the human experience, and that we should not punish people for the substances they put into their body. So now I want to present a little short slideshow that sort of introduces the concept of harm reduction. And in order to do that, I have to share the screen. So I'm pressing that button now. And here we go. It's called Reducing the Harms of Drug Abuse and Punitive Drug Policies. So, are drugs bad? Not necessarily. The use of psychoactive substances is not abnormal or a sign of psychopathology. The use of mind-altering substances has been the norm among humans for as long as we've been recording human history, both globally and, like I said, throughout our time. And changing consciousness has often been termed the fourth drive of humans, in addition to eating, drinking, and sexual activity.
Look, you're smart, you're cool, and you don't want to die, so you do things to reduce the harm of the risks you take. That's called harm reduction. It's all around us.
Sexy.
Harm reduction is common sense. It stops people from being injured and dying from things that are preventable. It saves lives, it saves money. It's smart. Here's a fact. Last year, 47,000 people died of drug overdoses in the United States. Because you're smart, you know these deaths are preventable. But here's something you may not know. Some kinds of prevention don't work.
Just say no. Who taught you how to do this? Any questions?
It's time to stop the drugs.
We've tried all these things, and still the number of people dying of overdoses continues to rise. But remember, you're smart. And because you're smart, you want to stop these preventable deaths. Do you know what is clinically proven to work? Harm reduction. You remember that, right? Harm reduction works for people who use drugs. It knows that people aren't perfect, but they deserve every opportunity to be as safe as possible. It encourages people to get educated and connected with healthcare. Harm reduction provides access to naloxone, the drug that reverses overdoses. It provides people with sterile supplies to prevent the spread of HIV and viral hepatitis. And when harm reduction is implemented in its most effective form, it gives people who use drugs access to supervised injection facilities in order to provide life-saving interventions in the event of an overdose. In 102 supervised injection facilities worldwide, there's yet to be a single fatal overdose. With more than 47,000 overdose deaths each year, what are you waiting for? Support safer, healthier communities by supporting supervised injection facilities in your city today. Learn more at www.harmreductionactioncenter.org.
Now, I think it's important to note that the number of deaths has actually exceeded 47,000 since when that video was made. Last year, it was estimated that more than 65,000 people died as a result of opiate-related overdose. So I wanted to talk a little bit about distinguishing the source of harm between the harms of drugs and the harms of drug policies. There's primary harms that are related to drugs. These include drug dependence, withdrawal, risk of overdose, family disruptions. Those are the harms that are specifically related to the addiction of a substance, whether it's legal or illegal. Secondary harms are those that are specific to our drug policies. Those are the increased risk of infectious diseases because we don't allow people to buy sterile equipment. Law enforcement, with all the harms that come from arrest, including incarceration. We have laws that allow the police to take your property so you can lose your home. We have a whole list of sanctions that apply to having a drug conviction that include not being able to get access to benefits, to money to go to school, etc. And then there's the permanent stigma that never goes away for people who've been labeled drug offenders by our society. And if you look at this list, you see that the harms of drug policies greatly exceed the specific harms related to using drugs. Now, this chart looks at the current crisis that we're in. Many people say that we're in an opiate crisis or an opiate-related overdose crisis, but I think that we actually need to call it a fentanyl crisis because there's been a dramatic increase in fatal overdoses, but it's been driven by the presence of fentanyl, which has been laced in heroin and integrated into the heroin supply. Fentanyl is 30 to 40 times stronger than heroin, and many people, when they buy their drugs, have no idea that it's in there. The fentanyl that's showing up in the illicit drug supply is clandestinely produced, primarily in laboratories in China. So people are not accessing fentanyl that's been diverted by pharmaceutical companies or created by pharmaceutical companies. The drugs that they're getting are coming from these illicit labs. And as I said, last year there were approximately 65,000 fatal overdoses, and fentanyl has been a factor in an increasing percentage. If you look at this chart, it shows the 27 states that have had a major increase in overdose deaths related to synthetic opioids. The bottom 7 are the worst states. That's Maine, West Virginia, Maryland, Kentucky, Ohio, Massachusetts, and New Hampshire. If you look at the gray line, that represents deaths related to fentanyl. which you see is much higher than other synthetic opiates. So I think that we need to start acknowledging that what we're in is a fentanyl crisis and that we need to have solutions that are responsive to that. This video is specifically about safer injecting, which is one of the things that you want to educate people about. And it's an example of a specific form of harm reduction.
5 things to know about safe injecting. 5. Clean your hands. Getting your hands clean before and after injecting is one of the best ways to avoid an infection. Get in there and scrub your hands properly. If you don't, you can pass on lots of nasty bugs and infections, especially when you're balling up filters or helping someone else inject. 4. A new kit for every hit. The most important thing you can do to prevent the spread of infections is to have new equipment every time you inject and to never, ever share. That's everything. Needles, barrels, swabs, spoons, cups, water and tourniquets. New equipment keeps you and your friends safe. Your local NSP can help you with new injecting equipment and disposal of the old stuff, and most of it's free. 3. Filters are your friend. Filters help stop dirt, dust, cigarette ash and other nasty bits that might end up in the mix from getting into your veins where they can do serious damage. Proper vein care is really important, and preventing damage to your veins will keep you healthier in the long run. Whenever you can, use a filter. A dirty hit isn't fun. 2. Bevel up. Needles have a beveled edge, and it's important that the needle is always facing bevel up. The needle is designed to make a small incision, and trying to inject with the needle turned any other way can result in vein damage, which can lead to infections and worse. Remember, bevel up. 1. Pack it up. Lastly, it's really important that you clean up properly and dispose of used equipment responsibly. Don't leave it lying around. Put it straight in the sharps container, a disposal bin, or a puncture-proof container, like a glass soft drink bottle. Your local NSP can help with the disposal. Mobile NSPs will come to your door to collect your used equipment. And remember, give your hands a good wash. For more information about how to inject in a safer way, then check out touchbase.org.au.
An NSP is the Australian term for a needle exchange program. And then this final video talks about the thing that we're trying to do now in the States.
Hoping to give heroin addicts a place to safely use the drug, the mayor of Ithaca, New York has proposed creating the country's first supervised injection facility. The proposal would allow medical professionals to watch over addicts as they try to recover and to keep users safe through steps like cleaning needles. Mayor Savanti Myrick told the Huffington Post, "Using heroin is bad for you. Dying from an overdose is even worse. We have to keep people alive and get them the resources to get clean." Myrick's arguments are partly based on the apparent success of Canada's only supervised injection site. Researchers at that site claim 10 years after Vancouver's site opened, fewer citizens were injecting, more were seeking treatment, and HIV transmission through needles had dropped significantly. A representative told WCBS 800 people come to the site every day, with 10 to 20 overdosing each week, yet none have died there. She said people die because they inject alone. Not everyone is convinced, though. For one, experts have noted it's a difficult and arguably dangerous legal position for a city helping people use narcotics.
There is no way to use heroin safely. It kills families, it kills communities.
In lieu of a center, others in New York have instead proposed more funding for law enforcement or supplying drugs that curb heroin cravings, like methadone, to hospitals. For Newsy, I'm Ryan Beek.
So that's a brief introduction to some of the concepts and practices around harm reduction. And when we're all done, I'm happy to take any questions that people may have.
So we're going to hear some more about harm reduction from Keith Paterson from the Harm Reduction Coalition. Kiefer comes to his work at the Harm Reduction Coalition's Government Relations Manager, following a decade of community organizing and direct service experience. In his role at the Harm Reduction Coalition, Kiefer works to support harm reduction policy and advocacy at the federal, state, and local levels, with a special emphasis on implementation of federal funding. And for some ring service programs, He's deeply interested in the intersections of HIV, HCV, racial and economic justice, homelessness and housing instability, and LGBTQ identity, and strongly believes that service providers, community groups, and people with lived experience are key stakeholders in any true representative policy work. So Kiefer, can you share with us some more about that incredible work you've been doing?
Yeah, thank you. From my rather ridiculous bio, I'm Kiefer Paterson. I'm the Government Relations Manager of the Harm Reduction Coalition. I work at the intersection of both policy work and capacity building and technical assistance to programs looking to run harm reduction programs like syringe service programming, needle exchanges, homelessness outreach programs that work with people who use drugs. And today,
A little bit louder.
yeah, sorry. Today, I've been asked to talk a little bit about drug users union and drug users unions and drug user organizing, and how those relate to pre-arrest diversion programming. So Deborah gave a really great kind of overview of some harm reduction philosophy and practice, but specifically I want to talk about something that I think is really key to the domestic harm reduction movement here in the United States. And there we go. It's important to note that harm reduction is first and foremost a movement built on social justice and built on the belief in and respect for the rights and dignity of people who use drugs. And the Harm Reduction Coalition has on our website kind of our 8 core principles of harm reduction, and 2 of those, which I think are central, are that we believe that good harm reduction ensures drug users and those with a history of drug use have a real voice in the creation of programs and policies designed to serve them, and that drug users themselves are the primary agents of reducing the harms of their drug use, and we seek to empower users to share information and support each other in strategies which meet their actual conditions of use. As a result, the leadership of drug users themselves is one of the foundations of the harm reduction movement, both nationally and internationally. And the harm reduction movement in the United States itself arises in part out of users organizing amongst themselves to form formal and informal networks, collectives, and unions to support one another and advocate for their own liberation. When harm reduction and needle exchange programs in the United States started, this was before there was a legal framework that allowed these things to happen with government sanction. This was about users protecting one another. And when these networks come together, their structures can vary a great deal, but as legal frameworks have come together, as public health in the United States has embraced harm reduction, there's more of an institution built up around providing these services. These unions, as they come together, will often come together either wholly separate from these institutions or partly embedded in them. So drug users unions tend to be either autonomous or semi-autonomous. They may have a informal or semi-formal relationship with their local needle exchange program. They might be formed as a subset of that program's board or as a coming out of a client advisory board. They tend to be membership driven and formed exclusively of people who use drugs. Sometimes they'll include recent former users, but most peer networks or drug users unions will be predominantly run by folks who are currently using themselves. And the distinction between the policy advocacy and political advocacy of these spaces and their service provision is often, there's not much of a distinction. That harm reduction outreach and the desperate need for things like needle exchange programming and particularly overdose prevention, naloxone distribution, which is the overdose reversal drug for opiates, go hand in hand with the political education and community mobilizing that drug user unions and peer networks engage in. For needle exchange programs, when we talk about their benefits, we often frame them as, the needle is just the opening to a much broader engagement in social services, into community, into medical communities, and the needle is the smallest part of this. In the context of a users union, it's very similar. By engaging in service provision and needle exchange and overdose prevention, users unions and peer networks are providing a really important essential service that keeps people alive, but it's also how users unions then begin to organize and form really important and powerful networks. In Deborah's video about supervised injection facilities, the only legal North American SIF was mentioned, Insight in Vancouver, Canada. And I think it's really a shame that in the US, often when we talk about that supervised consumption spaces or supervised injection facilities as an intervention, we praise Insight, which we absolutely should. It's a really incredible program. But we never talk about VANDU, the Vancouver Area Network of Drug Users, which was the collective of users themselves organizing who were running an underground supervised injection facility for a decade before Insight came into existence, and whose political action is what led to the legal framework that allowed Insight to come to be. And that without the existence of VANDU, there would be no Insight. And that relationship between the harm reduction service provider, the community it serves, and that community's own political self-advocacy is really the basis of the domestic harm reduction movement. And I spend a lot of time working on federal funding to programs, but it would be remiss of me to pretend like when I'm doing that work, I'm not also spending a tremendous amount of time talking these programs about how important it is that they involve their users in their political advocacy, because their own sustainability is in large part driven by the liberation of their participants. And without that liberation, then their program is parasitic. So in the US, I wanted to give some examples of some users unions that are in existence. And, we often use this phrase users union. There's also things like peer networks, collectives. The formation and logistical framing of these really kind of vary. So I'm including some programs in here that wouldn't identify as a users union, but they are user-driven, user-led, and function in many of the same ways. But programs like Be More Power in Baltimore, the Salespeople Harm Reduction Alliance, San Francisco's Drug Users Union, Vocal New York. I mean, from those 4 programs alone, you have Vocal, which is a multi-million-dollar program in New York City that does both community organizing, but a whole range of services, to Be More Power, which has only 1 paid staff member. So the shape and size of these programs vary a great deal, but all of these programs have at their foundation the leadership and driving force behind them being the users themselves. And this is only a small representation of a large number of these programs that exist in the United States. And in the context of arrest diversion programs, outside of the fact that users organizing amongst themselves to make political change in their own environments is itself going to be arrest diversion, because it's going to help end the drug war, diversion programs need to be partnering with their local harm reduction providers and their local users unions. And funders should be tailoring their grant making to support user involvement in the development of these programs. And an example of that is actually CJI Starving the Beast, of which 2 grantees, Be More Power and The Chosen Few, are 2 drug users unions in the United States. I'm happy to talk more about how users unions influence local policies, or answer any questions, but some additional resources. And I know we have people on the phone who don't have these links, but I imagine these will be going out. But there's the Manifesto for a Drug User Liberation Movement, the Vancouver Declaration, Nothing About Us Without Us, which is a manifesto by people who use illegal drugs. And We Are the People, drug user organizing in the United States. Those last 3 documents all come out of INPUD, the international network of people who use drugs, and the Manifesto for a Drug Users Liberation Movement was written by VANDU in the early 2000s. All of these are really wonderful documents and examples of people who use drugs declaring for themselves what it is that they need and why it's important that they be involved in any sort of drug policy work happening in the United States and internationally. And a bit of a self-plug, but if you want to know more about drug users unions or want to meet some of these amazing people, I'd really encourage you to attend the Harm Reduction Coalition's 12th National Conference in New Orleans this October 18th to the 21st, where we'll have an entire drug user union track and hopefully have many of the folks here that we'll be talking about.
Thanks so much, Kiefer. That was really helpful and I'm sure very educational for folks. You see now how that CJI is with our drug use union grants. Folks doing really great work. And I'm gonna move on now to share with you a little bit about Monica Jones, who's gonna be on next. And Monica is a Black transgender advocate who also advocates for the rights of sex workers and low-income women of color. She holds a degree in social work from Arizona State University. She's advocated at the United Nations in Geneva and in New York, and has presented at international AIDS conferences in Australia and South Africa. She's been a keynote speaker at numerous events, including Desiree Alliance Conference in 2016. She's the founder of the Outlaw Project, an organization based on the principles of intersectionality to prioritize the leadership of people of color, transgender women, gender non-binary, and migrants for sex worker rights. Thank you, Monica. Please share with us. Oh, we can't hear you. Okay, there we go. Oh.
You can hear me now?
Yes, thanks, Monica.
Okay, I'm going to try to speak fast because they're doing some construction and they just started again.
Oh.
Yes, and so I do a lot of work surrounding sex work, sex worker rights and sex work and diversion programs and how they're used to police our communities. And so, next screen. And if you look at the definition of a diversion program, it is basically to deter someone from doing something that they did on their day-to-day life. And so this happens due to the criminal justice system, either before arrest or after pre-booking. And this happens across the board in so many states. And so if you look at diversion itself, the definition of diversion is to move from something or to go off something. And if you're saying that someone's natural life pattern is either to sex work or to do drugs, and you're saying we need to change that behavior, to have a program is solely based on changing someone's behavior. It's not the way. And so we're going to move to the next screen. So there are many types of diversion programs now, especially with the new anti-trafficking laws that are coming out. A lot of organizations are jumping on the bandwagon on diversion programs. And we have like Project Rose here in Phoenix, Arizona, where they use police to go out there and arrest individuals to get them services. And under this guideline, the services were through Catholic Charities, the Phoenix Police Department, the Phoenix Prosecutor's Office, and ASU School of Social Work, and other grassroots organizations. And if the individuals did not qualify for those programs, they were prosecuted, might not be at that time, but at a later date. And then we have LEAD in like Seattle, which is basically the same thing. And these programs are offered right before you go to jail or right before you see the judge. And the only benefit is that you're not being charged with anything, but you still have an arrest record. Mm-hmm. And so that is on your arrest record. Next slide. And so I have a little experience with diversion programs, especially under the anti-prostitution and anti-drug coalition. Well, in Phoenix, Arizona, there's a program called Project Rose I just spoke about. And it was offered by the ASU School of Social Work. I spoke out against it, was arrested under Phoenix under this manifestation law. And these laws happen in city ordinance happens in small communities and low-income communities where they heavily police Black and brown minority bodies in these communities. And right next to where I live at is a nice neighborhood called Arcadia. The ordinance is not there. It's not in Scottsdale. It's not in very predominant white neighborhoods. They're only in low-income areas. And so Project Rose literally went out into these communities, sent police officers into these communities to arrest individuals who they thought were engaging in sex work, online or street-based. And there's many reasons why people sex work, survival sex work, and just it's the best option for anyone. And so we can look at the individuals who engage in sex work and use drugs. The impact on these individuals are great. And so I'm going to tell you a little story about Marsha Powles. Marsha Powles was a sex worker and a drug user in Phoenix, Arizona. She was arrested for prostitution after the cop followed her and offered her drugs for services. She was sentenced to 2.5 years in Phoenix, Perryville prison. And then halfway through her sentence, she was left out in the hot Arizona sun where she died to heat. And her organs literally cooked inside and she was found with blisters. There was no justice for this individual. So when we look at drug laws and diversion programs, they are to prevent harm to anyone. But with the criminal justice system, in Marsha's case, there is the ones who committed the harm to Marsha Powles. And so like Project Rose, they're all about finance and everything else. And so let's move to the next slide. And I think we should move, when we look at diversion programs, we should move from diversion programs into harm reduction. I had a great experience in Sydney, Australia, where these programs they have are very great. So they have like the Clean's Cross Clean Needle Exchange program, where they actually go out into the communities, King's Cross unknown sex worker area, and provide clean needle harm reduction kits. And they actually, in the parks surrounding King's Cross, they have IV disposable bins, especially in the safe houses where sex workers go in to do their job. They have clean needle bins inside the safe house. And also they have condoms, they have a place where you can get tested and everything else. And this is basically out in the streets where people need to be met. And so if you look at harm reduction from a social work perspective, and actually coming from the social work guidelines where you gotta meet the individuals where they're at, that means actually going into the communities, providing direct services within the communities. And this can happen either way by setting up a drop-in clinic within the target community, going into the communities with RVs, providing services to the communities at the time that the communities are out doing what they need to do. And so when we look at these laws that criminalize just existing in this world and trying to cope with the trauma of existing in this world as a Black trans woman or as anybody, any minority group, you find that it's the heavy policing and that leads to the mass incarcerations of individuals who are introduced into the justice systems by diversion programs. They mean good, but they introduce individuals into the criminal justice system. And so next slide, I think that's okay. Oh, I think I did this one already. So let's move to I guess I'm through. So yes, and so my name is Monica Jones. I'm the founder of the Outlaw Project. And the Outlaw Project is named after Sharma's Outlaw. She is from DC. She was a trans woman who died. And there was lack of access to health care because of gender markers. And so we moved towards to identify the intersectionalities of the barriers that people face when trying to access services within their own communities. And so the Outlaw Project is working towards that. Thank you.
Thank you, Monica. Thank you very much. What we're hearing, I hope we're learning and hearing that it's really important for programs that we're providing to communities to be targeted for those particular communities, right? To address the needs of that particular community. And so those communities are the ones to design them. I'm going to move to Keith Brown. He's the Director of Health and Harm Reduction for Katal Center for Health and Equity and Justice. He joined Katal in May 2016 as the Project Director of the Albany Law Enforcement Assisted Diversion Lead Initiative in Albany. As the Director of Health and Harm Reduction, he serves as Medicaid, public health, case management, and harm reduction expert, assisting municipalities throughout the country in the county in developing strategies that address public health and public safety. So just so you know, LEAD is a growing model of government and community involvement in diversion programs. And there are lots of critics of that program. I think that Keith is going to share with you the work that they do with communities to strengthen their position with regard to the design and implementation of programs. I think they're also, Katal is working with 2 of our grantees right now. But I just want to say that CJI is not endorsing LEAD as a model in any way. We're just providing information about folks that can help communities design their own programs. So take it away, Keith.
Great. Can folks hear me okay?
Yes, we can hear you.
Great. So I should start by saying that somehow I'm both a person who is responsible for being a project director of a LEAD program and also a critic of LEAD programs. My background that I didn't include in that bio is that I'm the founder of the harm reduction program that serves a 12-county region of, including the capital of New York State, the capital region. My background is firmly rooted in harm reduction, both programming and philosophy, providing services for folks with HIV. So my involvement in LEAD sort of grew out of that. And I should also say that one of the reasons why we do the work we do around this model of community leadership teams is that in Albany, we feel like our LEAD project is one that has really aimed to be was developed and built by the community based on the community's needs, and now continues to have some pretty key kind of rooting in that. So I'll talk a little bit about that in terms of how it works with our model, but that's not to say that this isn't something that could be used for any kind of pre-arrest diversion program, whether it's specifically built off a LEAD platform or not. So I'm going to read some of this because I know we have some folks on the phone, but when we talk about community engagement in general, the community needs to be a partner for programs and projects to be effective and sustained. This is what everybody has talked about so far, and I think Kiefer did a great job of talking about how the folks who are going to be directly impacted, especially by something that aims to reorient certain components of the criminal justice system, folks need to be very, very meaningfully engaged in that process. I also will say that when I say that I'm a critic of LEAD programs, also there are some areas of the country where the model has been adopted and has not really been adopted in ways that I would say are faithful to the core principles or really this community engagement piece. And so the goal is to gain insight and input from community leaders, people who have lived experience around substance use, mental health, and/or poverty. And then it's really important for the folks who are directly impacted to be the ones that are providing education to community members, the business community, and others about pre-arrest diversion models. So one of the things we tried to build from the beginning in Albany is that the community has a role in applying pressure and creating transparency and accountability of the partners, especially law enforcement. That's something that we had been building for a while with folks like Dr. Alice Green from the Center for Law and Justice here in Albany. Have been fighting for transparency and accountability from the police for an awfully long time. We made a move in Albany toward community policing. I should also say that I had built a pretty solid working partnership with the police around issues of harm reduction and drug user health prior to us launching, which provided a good base for us to be doing something different. Community engagement fits into more broad community engagement strategies, right? So you're talking about pre-arrest diversion as being one piece that we want to have the community engaged in developing and monitoring, but also, how does that fit in with things like community policing or community accountability boards or other parts? And here, our community feedback drives our changes to eligibility criteria, diversion processes, et cetera. So when we were developing our eligibility criteria and our diversion protocols and processes, there were community members. Our community leadership team was engaged in that process. So this wasn't just the police defining for the community what the eligibility criteria was for our diversion model. That's actually one of the key reasons why, when we looked at the Seattle model of LEAD, where they were focused on low-level drug offenses, we said, for our community, we have folks who are engaged in the criminal justice system around issues of mental health and poverty too, that we thought we needed to include in order for it to be something close to a meaningful program for the community. We also thought that when you think about what's happening with the current kind of overdose crisis in the country and our poison supply, we have this public perception that's rooted in some reality that it's white folks dying of overdoses. And so if we were to build a model, at least in Albany, that was trying to divert folks away from the criminal justice system, it could be both operationally and viewed by the community as another way that we were building a mechanism for white folks to stay out of the criminal justice system. And we felt really strongly that, and the community felt really strongly that, if we were to think more broadly about our eligibility criteria and include mental health and poverty, and then also not focus obviously solely on opioids, that was a way that we could advance some of that. And we've been successful somewhat. The thinking is, somebody who's shoplifting to support a dope habit, of course we want those folks diverted from the criminal justice system, but we also want, a single mom who's shoplifting baby formula, and we want folks who are trespassing because they're homeless, and we want people who are getting open container tickets because they're drinking at the bus stop because they don't have a place to live. So that's a little bit about our thinking through that. And then just back 1 second to the political support and accountability. We felt really strongly that this had to be the community's program, that this couldn't be the Albany Police Department's program, and it couldn't be, the harm reduction program's program. It had to be the community's program, both, for transparency and accountability, but also because that would then mean that it would transcend leadership changes. So if there was a new mayor or there was a new chief of police, which we're going through a police chief search now, that those folks wouldn't be able to step into political leadership without being really bought into what we're doing. So in Albany, the community leadership team was formed as a vehicle for community members who are not otherwise connected to the LEAD process to provide input, ask questions, and help hold the program accountable to community demands for reform. And the CLT provides the community with an additional avenue for input into the program. So what it looks like here is it's made up of people with lived experience. It is anchored in our local civil rights organization, the Center for Law and Justice. One of the things that gave our program some immediate credibility in the community was the fact that prior to some of our community policing initiatives and LEAD, if Dr. Green from the Center for Law and Justice and the police department were in the same room at the same time, that's likely because something went down, right? So, and it was about accountability, and it was about that contentious relationship. And so the fact that those two entities were working together to develop something that would reorient our approach to mental health, substance use, and poverty in the city, that was meaningful. And the fact that the CLT was anchored in the Center for Law and Justice was immediately provided credibility for people. It is facilitated by a community engagement coordinator. That is a funded position. That's funding that comes from the city of Albany. So there is a city of Albany actual municipal investment in the community engagement around what we're doing, which is important. It includes community and neighborhood advocates. They have access to arrest data and have a role in processing it. This is crucial. And this is something that to my knowledge, is not happening in other places where they've instituted pre-arrest diversion models. Our community leadership team can view on a monthly basis who is arrested and who is not arrested for our eligible offenses and what the racial and ethnic demographics look like for those people. So that's really crucial to holding the program accountable to doing what it says it's going to do. And that group conducts outreach to neighborhood groups, businesses, and other entities. So it was actually the community leadership team that went out to our business community to talk about what it was we were doing, so that they had an understanding of what LEAD is and what they're, that they'll be asked to okay diversions when it's offered. And they also made sure to get out to the community to let folks who may be impacted by LEAD know that it's not a snitch program, that folks are not required to provide any information to the police as part of their participation, to let people know that this is very different than drug court. Monica mentioned a couple of things about how some pre-arrest diversion models are treatment or rehabilitation in lieu of arrest. That's not the way our model works. It does use a harm reduction approach in that the person decides what it is they want to work on that might impact their contact with law enforcement. So we have folks who are actively using who say, I'm not ready to stop using and all I need is a place to live. And that's what the case managers will help them do. So it's really rooted in that. And then if we keep the threshold low for success, all we require our participants to do is complete an assessment with the case manager. They're not required to do anything that's identified on a service plan. They don't, a judge, a lawyer, the police, nobody except for them and the harm reduction case manager decides what it is that they want to work on. And then if they complete that assessment within 30 days, there's nothing shows up on their record at all. There's no arrest. There's no arrest entry in there. Doesn't show up on what in New York is called a file 15. It's just goes away. So here's a few early outcomes. Again, they have an active role in reviewing program data, informing policies, procedures, and protocols. One example of that is that we initially did not include people with active warrants in our eligibility criteria, and both the community leadership team and the police actually decided that that was silly and that we needed to figure out a way to get folks with warrants into the program. And so we actually worked out a process for that surprisingly to, I think, everybody who hears this, the Albany Police Department were the ones who said, we could help someone clear up a warrant in a couple minutes by taking them to court and getting an appearance. And that way the warrant is cleared so that they can get benefits that they might need from the county, housing and other resources. And it's as simple as just taking that person down. So, they decided that that was the way that they thought that they could meaningfully do that. The community leadership team, interestingly, looked at the data and said, the folks that we're excluding because of warrants are disproportionately Black and brown, and that's not being faithful to what we want the program to be. And so everybody else agreed. And so it was just a way that folks kind of came together and informed the process and made the program more meaningful. There's a better community understanding of the program. We did hear from another lead model throughout the country that they had almost no diversions for a while because the community was hearing that it was a snitch program. And so obviously folks were not accepting the diversion. And we, knock on wood, have not had that as an issue, and folks by and large do accept the diversions. The group has had a larger role. I should mention that one big thing that came out of that was that in the national search that we're undergoing to find a new chief of police, the city who is undergoing that search came to the community leadership team to say that they wanted them to help inform the process. So we actually had a meeting with the Center for Law and Justice, some folks from the community leadership team and others to inform that process. And then we're trying to tie it into larger community organizing efforts.
Thank you so much. Thanks so much. So now we're going to open it up for questions. If people have questions about what has been presented, I'm sure that some new information to some of you. And I'm happy to take them now. Do we have any questions? So, oh, I thought I heard one. You can unmute your phones if you have a question. One of the things Monica mentioned as I'm waiting is that they want to arrest people to give them services. So, you know, we can see that that would be the exact opposite of anything that we would be involved in doing. He talked about how folks looked at the impact on Black and brown communities of some of the policies and tried to change some of those in Albany. So we're looking at, you know, a very wide spectrum of efforts that can take place with a harm reduction approach that can make a difference. And the bottom line is, like, I know for some people this is new. You hear, oh, you're not making a standard that you have to be clean and sober. The bottom line is that we're trying to save lives, and saving lives, not just people overdosing, which is crazy at an epidemic proportion. You already heard 65,000 people last year alone, but also we're trying to save lives, to save people from the incredible devastation of involvement in the prison industrial complex, right? To be involved in the prison system, to be in the criminal justice system, and how those impact your life for years and years to come, and your family and friends. Monica, did you want to say?
I have a response to that, because the response, they literally are arresting people for services. Right. It might sound good because even in the conversation, there was no talk about sex workers being wrapped up into the LEAD program. Even in the pamphlet from Albany, there was no mention of sex workers in that meeting about how to best serve sex workers. And especially, only time that sex workers were mentioned is if they were doing it for survival sex work, and when they were doing it to support their habits. That's the only reason, that's the only way sex workers were mentioned and LEAD. But when they do those programs, law enforcement assistance diversion program, the law enforcement has an incentive to go into the communities and find individuals who best meet their needs, their standards, or criteria of the LEAD program, and take them down there to the service provider. If they refuse to take those services, they are charged with a crime or booked later on. And so there are arrests happening with these LEAD program and LEAD-like programs.
Yes, and he said that, and he said that. He said that there are lots of different versions of this all over the country, and a lot of them are not following a harm reduction LEAD approach. So that's why it's really important for us to know the differences and to be really clear and educated when we're looking at how to assess them.
We did have a sex worker in Albany, New York, a Black trans woman, serving time because she was arrested. And so where was LEAD at during that time?
I don't know. I don't.
Okay, so that's all. Okay. Thank you.
Yeah, I'm not, as I said, CJI is not endorsing the LEAD. Yes. I'm just saying that we just need to be really clear about how we assess the programs in terms of what they're not doing. Because I know one program from city to city does not look the same, but it may have the word LEAD on it. And so, we were really clear about how we were doing our funding, as you know, Monica, in terms of who we were
clear, yes.
So what we want to make clear is that we believe that the answer lies in a non-coercive approach, right? Where individuals themselves are making the decisions about how they want to conduct their lives, how they want to address the issues that they have, and not having the state determine for them what the best way for them to handle that is. What we're finding is that if you make services available to people, if you make programs available to people that are designed for their communities, they're much more likely to use them. That's why we said effective solutions lie in the communities. And I don't think that Kiefer would argue with that at all.
Okay, perfect.
Okay.
Thank you.
So I just wanted to know if there were any other questions.
There's a Q&A question in the...
Oh, you see one? Could you do that one? Oh, I see. Sorry, Rondo. What's the name of the group in Albany that was being talked about? And so you're going to tell them real quick, the Albany League. Keith?
Yeah, are you, I'm assuming, maybe, do you mean the civil rights organization, the Albany Center for Law and Justice? Or you mean the name of the group? Oh, the Community Leadership Team is what it's called. Oh, LEAD, LEAD, Law Enforcement Assisted Diversion.
And we're going to send out presenter contact information will be sent out after the webinar, probably on Monday.
And I'll actually forward on. We have a packet of information that includes like our eligibility criteria and the role of the community leadership team and a bunch that we can get out to people.
Okay, great. That'll be helpful, Keith. Also, again, I mentioned that the information for all our presenters is also going to be on our website, so you can find it there as well when you click on. And we are recording this so that we can, anybody can access the information after. Thanks. Any other questions? I don't have any more questions.
No.
Okay, so I just want to make it really clear to you that we were just trying to present to you the concept of harm reduction and how that works and why we feel so strongly about supporting it, how many lives are on the line in different sorts of ways. We're going to have another webinar later in the year, probably in the summer, in which we're going to highlight the work of our grantees and the amazing work that they're doing. So stay tuned. We'll keep you informed about that. We will send out an email and invite you to do that as well. So this is just an introduction to the program. I just want to make it really clear that this program, again, was generously provided its initial funds from OSF, and we really appreciate that. But as we move forward in the program is designed to encourage and initiate us to find alternative sources of funding. So I just want to really just put out there that if you're seriously interested in decreasing mass incarceration, to end mass incarceration, then one of the things you should be doing is helping to support serious, common sense harm reduction approaches to drug abuse and addiction issues in the United States. And that's what CJI is trying to do. So I'm inviting you to join us in that regard. Thank you so much for your time and attention. And look for our new webinars on other issues moving forward. I appreciate it. Thank you, Deborah, Kiefer, Keith, and Monica. Thank you all. We appreciate your work. We'll be getting together later this year to do another round of grant making. Take care.
Thank you. Have a wonderful day.
Okay.
Bye.